Welcome to the Art of Patient Communication. I am Dr. Kritika Mehra, and today we are talking about what every clinician would like to hear, especially if you are younger clinicians, that your communication is only as good as your clinical foundations. And for that, we've got Dr. Jimmi Patel here, and we will be unpacking this topic further.
Yes, this one is very close to our heart because so many times you come across young clinicians who want to sound very confident. In my view, confidence is not a script, it's not a charisma, it's competence. You know, without competence, you can never sound confident. So I suppose this whole concept of fake it till you make it is back to front. Yes, that's right.
So I guess today's conversation is really just a roadmap that how technical mastery actually gives you the tools for stronger or confident communication.
Of course, like you come across so many courses and trainings, a workshop where you go there, and especially the young ones who just go there and what they're hearing is that, master the communication, master the presentation. And that's the first thing you have to really conquer if you want to be a successful clinician. But then I believe that without really mastering the clinical execution side of things first, communication is not going to get you anywhere. If anything, it can be it can make your life more difficult because you might find yourself in a scenario where you've never been before. And again, you will then need another sort of communication to get yourself out of it. So mastering the execution is the most important part. Yeah.
Because if you try to break it down, like what is patient communication? What is it? It is pretty much, first of all, obviously interviewing the patient, then coming to diagnosing, explaining the diagnosis to the patient, explaining the treatment options, giving them or recommending a treatment option to the patient that fits in with the patient's lifestyle, and then what can go wrong with execution and how will you manage that. So these are the 7 to 10 questions that you need to answer or preempt for the patient, and you pretty much lay them all on the table. So if you can package all that elegantly without instilling fear in the patient, keeping the positive, vivid acronym in mind. If you can do that, that's fantastic communication.
Because without that absolute clinical foundation, no matter how hard you try and how much you practice and how scripted someone can give you the communication scenarios, your execution of that communication is going to look very robotic, very fake and inhuman pretty much. So yes, I think in reality, you really have to do those dirty reps and master the clinical execution side of things first before you start really focusing the communication mastery.
Yeah. So Jimmy, you were just talking about like doing dirty reps, right?
Yep.
So can you just break that down a little bit? Like what does the dirty reps stage of a clinician looks like? Like what was your stage like, or what did you go through?
I suppose dirty reps are like in anything that you do in life, they are the building blocks pretty much, because that's when you really figure out who you are and what works for you. And then you go through the failures in so many different variations where you figure out that, okay, the different versions of failures now I have seen, and then you come up with different versions of solutions. So in a clinician's life, there is no fixed number, but I would say the first 5 years are the dirty rep period, because that's when you are literally sort of walking into this practical side of profession, because you've obviously gained the degree from the university, but now you're walking into the workspace. So you walk in, you are learning, and then if we talk about dentistry, you learn how to execute. So in that period, you do all the basics of dentistry, your
Filling,
checkups and
extraction.
fillings and extractions and simple root canals and cleans, and it just goes on and on.
Talking to mums and dads of patients.
Of course.
Yeah.
And it can get quite repetitive and boring in some sense.
Yeah.
But at the same time, that's what's going to build that strong underbelly for you to become a great clinician later on in your life, because that's the time where you have to keep your head low, because every day they are the most stressful sort of years of your profession. If I talk about dentistry, of course, here, because in that time you will do something and 50-60% of your days will not go to the plan, and then you go home with some form of failure or disappointment. And then day in, day out, that failure is going to present itself in different way. And then you go home and reflect. You talk to your colleagues or your seniors, your mentors. And then you do the reflection and you figure out that what worked for me, what didn't work for me, why it happened, what happened, how could I have done it better. And that reflection and then the learning happens after that reflection. And then you try to apply that learning. But then there is a stage where to apply that learning again into the next day, you have to have this enormous amount of courage to again put your hand up to do the same process again, right? So they are the hard yards. And that's what I call it as a dirty rep years. And they're extremely important, because until you have done this, again, if I go back to what we were discussing, no matter how well you try to communicate something, if you haven't dealt with the failures number of times, you will never effectively communicate yourself and the treatment.
I think it's not just about the failures. I think it's about just a procedure in general, like to be able to explain that to the patient without over-promising, without over-complicating it, without saying too much to get to the point.
Of course.
I think you definitely need that experience under your belt.
Of course, you over the years, you just figure out that, because you are filtering the cases on the fly, because you've done them enough number of times. The textbook tells you that, okay, if you're doing this procedure, these are the possible complications that you can come across. But then in clinical scenario, the case that you are handling or dealing with, that may not have 50% or more of the textbook complications that you're going to go through. So talking about those unnecessary complications, it makes no sense. It's not relevant. So that's when the effective communication becomes even more effective, when you have seen enough where you just filter through that information on the fly and then just become more concise with your choice of word and don't repeat yourself. And if I talk about myself, I remember I used to use words like probably, I think, I guess. So these sort of words disappear, and your communication becomes super solid and crisp and sort of black and white, where patients can see that you can visualize the whole process in a granular level, and that builds the confidence. So I think that dirty rep period and then building confidence through that is what's going to get you to more effective communication later on. So if I ask you a question, that would you want to share, or did you ever come across a scenario where you have gone through the dirty reps or figuring out what works for you, what doesn't work for you, and then that has led to a better communication eventually, or confidence building exercise in your career?
I think it would have been really good, Jimmy, if someone actually told me back then just to focus on the bread and butter dentistry in my first 5 years and really figure out what I really like. And I think that's why I chose this topic today, because I feel like when I look back in hindsight, I feel like I should have done this. Or if somebody told me that this is what you do in the first 5 years and then you go to the next stage, it would have been a dream.
Of course,
like coming from my point of view, I think in the first 5 years, yes, you, as you said, the day in, day out dentistry, it becomes boring, right?
Of course.
And because you are just trying to be good at it, and because you're just making, you're
making it happen.
Yeah, that's it. And because it's like that, you're always trying to look for the next excitement. What other course I can do, or what other training I can do that
next glamorous thing.
Yeah, that can inject a bit of a dopamine, right, and make me feel happy about
because
the dentistry.
You almost look less boring by doing these other procedures.
It's
because if you keep doing the basics, you almost come across as a boring clinician.
Yeah, to yourself mainly, because you're
of
like,
course,
I'm actually, how good does it sound? I'm going for a veneer training course, or I'm going for Botox or fillers or whatever course, right? And I guess that's what happened when, like, veneers has always been that thing. Even now, even back then, when we graduated,
thing,
it's always a big thing. And when I remember in the first 5 years, like I did few courses on veneers, and I started executing them, right? I was executing a lot of other procedures as well, plus doing veneers. Now, there was one thing that I was feeling or facing every time I was doing a veneer case, is that I would get overly stressed the weeks before leading up to that procedure or that patient coming in. And then even on the day, I would be super, super nervous. And, I did that once, I did that twice, I did that 3 times, 4 times, 5 times, like many number of times. And I still could not shed that feeling off. And I guess that now when I look back, I should have actually left that long time ago, reflected on it and said, you know what, I have 10 other procedures that I can do, which I don't even think about. Yeah. And I never thought about them, never stressed me out. And I could still be the best version of myself while I was executing those procedures. And I was standing up and the patient was standing up much happier. Even with the veneers, like I would say that, there was no patient who was unhappy.
Bad outcome,
There was no bad outcome. But like, I know that because I took so long, because I was so careful, obviously I tired the patient out as well, right? So I think that's what it is. Like, I should have let that go long time ago, because I had other strengths that I could have focused on.
Yeah, you probably had these other parts of dentistry right before your eyes, but then because you were so much invested in mastering veneers,
because that's the thing.
Ignored the other things.
That's right.
So does that, like, if I understood you correctly, so from what I said to what you were saying, is that in the first 5 years of Dirty Reps, does that mean that you just focus on the basics, or you focus on something that you really fall in love? But then how do you figure out, while you're failing, multiple times, that, okay, because when you fail, you're not going to enjoy that process anyways, right? So how do we then figure out that, yes, I'm failing, but this is still something that I feel quite passionate about, and then I want to pursue this further? So how do you differentiate between those two things?
Yeah, I think like one thing, it's important to understand that dentistry, like you are treating teeth, right?
Yes.
In teeth, you are doing multiple procedures. You could be doing a root canal that needs a different skill set. You could be very good at extractions that needs a completely different skill set. Or you are doing orthodontics, with Invisalign or braces, another skill set. Or you could be a periodontist, a very finesse, skill set. Yeah, right. And I think, first of all, it's important to understand what sort of skill set you fall under.
Yeah.
While, again, I know it's very hard to do that in the first 5 years, but perhaps maybe reflecting on it and really mapping out your strengths, like what makes me nervous, what makes me feel good about myself.
Yeah.
Where did I walk away with a happy feeling? Maybe writing it down. Yes, it may sound very small to you. Like, if I'm very good with a filling or with handling the composite resin, which is what's used for filling teeth, you could be very good at doing resin veneers, that's still going to add a lot of value in patients' life, rather than saying, I'm only just good at fillings and not porcelain work or something big and mighty.
So in other words, we are talking, when the failures excites you and challenges you to work harder,
Yeah.
that's a good thing you should pursue. But when the failure leaves you with sort of very sad feeling over and over again, that's
Over
when
and
you
over
need to
again, I
start
think.
looking at
Yeah.
other sides of the
That's it.
the
There's
story,
always other doors. Like there's always something else you can try.
Correct.
Yeah.
Correct.
So let's break it down for the listeners, Jimmy. Can you simplify from your experience of how a young clinician should look at the first 10 to 15 years of their clinical mastery? That's what I would call it now. And how that would help them shape their communication.
I suppose I didn't have this clarity earlier, but now I'm 15 years plus in my career now.
Yeah.
So when I look back, this is what I believe probably the journey looks like, or it did look like in my case, is that the first 5 years is the time when you do your dirty reps and you apply and practice 100% of what you have learned in the university.
Yeah.
You don't pick and choose, or I certainly didn't.
Yeah.
I just said that, okay, I'm going to do everything because I want to know what I like and what I don't like. And then from 5 to 10 or 5 plus, you start picking that, okay, there is this third of dentistry that you did in the first 5 years that you just really do not like, or you're just not good at it, and it's not worth it. Sometimes the market that you are in, that could also play a role here, or the practice style that you are working in.
Yeah.
So that plays a role identifying that, okay, this is the part of dentistry that I want to probably not focus very hard on. So you drop the third of what you were doing in the first 5 years. And in 5 to 10, you were just dealing with that 65% of the dentistry, right? And then from 10 year plus, again, you drop another third. So you are now only dealing with that 35% of what you originally started doing.
Yeah.
Because you have really figured out what you are good at, what you are efficient with, what sort of client you are working with, what's working from the marketing point of view, what stresses you out less. So there are so many factors. But so from 10 to 15, you're just doing that 30%. And then you can happily stay there. And that's good enough for most of us, because you will realize that you are doing quite well if you're doing 30% of dentistry really well.
Yeah.
And then you can push the envelope even more, and then just focus on 10% of dentistry. It is not for everyone, because that requires absolute, because you can plan for it, but most of the time you evolve into that 10% through, again, everything through the market, your clients, your practice, your proximity, your training, everything, right? So from 15 plus years, you can just get yourself to that 10% niche, but that's much harder. It's much harder to execute and achieve than said. But this is the way I have sort of seen my career pan out. And I'm very happy with the 30% that I'm doing right now. Will I ever get to 10%? That's my aim. I'm trying. But it's something only time will tell us. So that's the way I see it. So yeah, hope that helps the listeners.
Yeah, I feel like that, unless someone has a real hunch, like, when they are studying at uni, they have such a big clarity. They know exactly what path they have taken. And we certainly know some really GOAT clinicians, in dental field, for example, who have done like extremely well. And they are the ones who knew their whole journey from get-go. From even when they were 5-year-old or 6-year-old, they just knew where they wanted to be, and they really pursued that path. And I think for clinicians who are really not sure at this time, or when they've just started, is like really like stay. What did you said a word, Jimmy? You said like keeping your head low and just honing those skills. And then I think the key getaway that you are saying is like staying in your lane. Do not look at any glamorous, any shiny courses on Instagram, or do not compare yourself with any social media dentist,
course.
because that's only going to feel you like
Make you
negative
feel
about
small,
small about yourself. So really work on your skills, because I guess you never see that part of anyone when they have their head low, when they are working on those skills. You don't hear about it. You only hear about them on the other side of the line when they are goats.
If you look at any Instagram clinicians, I love their work.
Yeah.
But if you really take the effort to go down since when they started doing,
like scroll all the way down,
typically speaking, their journey is only in the last 5 years when they actually started doing these amazing cases.
Yeah.
And before that, they were either non-existent or their posts were never related to the dentistry.
Yeah.
So that tells you that they were the years when they were no one. They were anonymous. Their heads were low. They were really practicing on their craft. And then they just emerged from nowhere. And then
from no one
cases,
to someone.
Cases just keep coming, right?
That's it.
And we should not fall for the trap that, okay, just because I see this, I want to be that person right now. And I want to start posting that or communicating that to the world from today, because the time in the trenches, no one talks about that. So that's the part that people need to understand and commit to. So
that's right.
Yeah.
And I think with as the clinical mastery, as you start narrowing down, if I understand you, what you're saying is, as you start narrowing down the skill set you have and what interests you or what really excites you, and then you just go in there, and then you can really see the communication rolling. You don't need to think it's like a script. It just rolls out, and as they say, the Gen Z, like you get that aura.
Yes.
And you just I think talk about that procedure. Yeah.
It's because you have done it. So because if you really look at that last 30% that's still with you, that 30% has been with you from day one.
Day one. Yeah.
Right. And
that's what's left.
That's what's left with you, right?
Yeah.
So the reputations that 30% or 10% has gone through in your career is
gold.
It is enormous number of time.
Yeah.
And by that time, you have seen all different variations and versions of it.
Yeah.
So when you communicate that, it's not a communication or a script. It's just basically the extension of your clinical ability.
That's it.
And you don't have to try.
Yeah.
It's effortless. It just comes out in the form of words and the body language.
Yeah.
So that's a different story. But it's nothing but your clinical execution just coming out in words. Your ability to
it's no that. Performance.
It's not a performance.
It's natural. No. It's just flowing. There. You are in the flow.
Yeah, and that's the message I think I want the listeners to take from this podcast or this episode, is that focus on communication because it is important. That's the whole point of this whole channel or this podcast. But there is something sometimes that comes first, and we have to really understand that first as well. Like I think in previous one of the episode we talked about communication can only be as good as how good you feel, how well you rested, what diet, exercise, sleep, all of that matters.
That's right.
Same way, your communication is also the reflection of
your technical,
how confident you feel in your technical execution part of the dentistry.
So the communication is the second layer. Would you say the technical skills, the technical mastery is layer number one? Then comes your communication.
I wouldn't even say mastery, but technical or procedural
foundation.
Foundation or procedural comfort is first, and then communication comes
the second.
Yeah. Yes.
Fantastic. Yeah. Thank you, Jimmy, for joining us at the podcast today.
Thank you for having me again, Kritika.
The takeaway of today's podcast is that really, really focus into one particular skill set that you are good at. You actually thrive in it, and you feel that you are in a state of flow with that procedure, and just hone that skill. Do not look at any shiny courses, any fads that the current market is going through, and change your lane. Just stay in your lane and just keep getting better at it, because that's what will actually affect your confidence, your communication, and your clinical career will just blossom in it. Here's a question for you. If you could share with me one procedure or one mastered skill that you have worked on in your career that has really amplified your confidence and changed the way that you communicate with your patient, I would love to know about it. Feel free to DM me or email me. Thank you for listening. I hope you got something out of it. Like, follow, and subscribe, and you know where to do that. See you next time. Bye.